दर्शकवृन्द नमस्कार। कार्यक्रम रूपान्तरणको आजको श्रृङ्खलामा तपाईलाई स्वागत छ। समष्टिगत विकाससँग जोडिएका विशिष्टीकृत विषयवस्तुमा विश्लेषण, छलफल र विवेचना गरिने यो कार्यक्रममा आज हामी नेपालको वास सेक्टर अर्थात् खानेपानी, सरसफाई र स्वास्थ्यको विषयमा कुराकानी गर्छौँ। खास गरी वास भनेको विकासका हरेक आयामहरूसँग निकट रूपमा जोडिएको क्षेत्र हो र जबसम्म यसको सुधार गर्न सकिँदैन तबसम्म विकासका अन्य क्षेत्रहरू प्रत्यक्ष र अप्रत्यक्ष रूपमा प्रभावित हुन्छन्। खास गरी मानव विकासलाई यसले प्रत्यक्ष रूपमा हानि नोक्सानी पुर्याइरहेको हुन्छ भन्ने कुरा विभिन्न अध्ययन, अनुसन्धान र अनुभवहरूले देखाइसकेका छन्। त्यसो भए नेपालको सन्दर्भमा अर्थात् नेपालमा वास सम्बन्धी भएका कामहरू के कस्ता छन् त यो विषयमा कुराकानी गर्छौँ। र यो विषयमा कुराकानी गर्नका लागि आज हामीले लिन्डा केन्ट्रो, वरिष्ठ वातावरण तथा आपतकालीन स्वास्थ्य विज्ञ हुनुहुन्छ, USAID, उहाँलाई चाहिँ निम्ताएका छौँ। लिन्डा, we welcome you in our program Rupantaran.
Thank you, Prakash. Thank you.
How do you introduce yourselves?
Well, as Linda Kentro, I suppose as an American, also having a master's in public health and working at USAID. But I came here a long time ago in 1981 as a tourist, and again in 1984, working in the private sector for a while. But since 2005, I've worked for the US government through USAID in the Office of Health and Family Planning.
You have been working in Nepal for a long time.
Mm-hmm.
What is the factor that attracted you to remain in Nepal for a long time and to be devoted to for the welfare of Nepali people?
Since the time that I was in the private sector, I was always pulled towards development work. There's something about it, the working for a common cause, working as a team. Development work is always a team. And now I find the opportunity to do that. I just feel honored to be able to work in Nepal. Working in a team at USAID, we get to use our own creative insight in planning programs, and then we use our oversight when our partners are actually implementing the program. That's government, communities, NGOs and all. And we're there to make sure that what we promise Congress back in America is actually happening.
Yes, you are significantly contributing for the well-being of rural people in Nepal. What is your experience working with these rural people who are illiterate, who are poor, who are innocent?
I actually feel, as I say, very honored to work with them, and I also often feel a bit in awe of how they manage. In remote areas, people who are very poor still have their dignity, they have their aims, they have their ways that they help each other. Speaking of illiterate, I've had the fortune to work with a lot of literacy programs early on in health literacy and actually reading and writing literacy. And what I find really moving is the sort of concept of interdependence, that we're all related and dependent on each other. It has very deep roots, that concept, but in development work it's very obvious too. I'll tell you one example. When we were working in literacy, there was a girl who had dropped out of school. No doubt she was needed to take care of the children or something. And when we came along with a literacy program, she joined, she did well, she went back to school, she finished school, she went on to nurse training, and then went back and worked in her community as a nurse. So that, to my mind, is perfect development, right? We came, we supported, she took that, moved with it, and then came back and gave back to her community.
In this long period, during these 3 decades, Nepal have been making tremendous changes in development sectors, especially some sectors.
Mm-hmm.
In your experience, what are the major changes that you have observed during this time? Nepal have been making tremendous changes in development sectors, especially some sectors.
Mm-hmm.
In your experience, what are the major changes that you have observed during this time?
Well, I wouldn't be the first one to say communication, media, other part of communication, roads and the transportation. But I think communication, as you all would know, is a hugely important part of the change.
Now I would like to draw your attention towards the wash sector, which is one of the specialized area of
Yes.
your development sector.
Yes.
Wash, that is water, sanitation and hygiene is the driving factor of every development, not only for Nepal but also every country and every human society. But unfortunately, even 38% peoples have no access of toilet in Nepal, and more than 80% people are becoming the victims of disease which is caused by the lack of safe drinking water. This is the scenario. How do you interpret WASH?
WASH consists of water, sanitation, and hygiene. And with water, what that means is that people get enough access to water, that they're allowed to their taps, that the tap isn't too far away, and that the water is running most of the time, so that they can get water. Safe water is an important part too. So a lot of our programs talk about the quality of water and how important it is to treat your water, because it's almost impossible if you gather water from an outside tap to assure that it's going to remain safe. The first step is to protect the source, and that consists of various simple engineering steps of creating a little inlet tank and then cementing the surface and such, and then making sure that people are keeping that area clean. Then there's actual treatment of the water once you get home, and that, boiling, we all know about boiling, but there's some other kind of exciting water treatment methods. One of them is called SODIS, which is short for solar disinfection, and that is so simple, quite amazing, but it works. You take a large clear plastic bottle, like the best one generally is the large, we say soda pop, large soft drink bottle, like a Coke or whatever. And this is not a paid announcement or anything, but you take that and put it in the sun for 24 hours, maybe turn it once, and it's disinfected just from the sunlight. Quite amazing, but that works, and that's really good for people who, for anybody actually. And then of course there's chlorine and push and other water chlorine treatment methods are very, very good. At any time, they're especially good in emergencies, but at any time that's a good way to treat water. And then there's another whole section of filtration, and right at home, I think many people are used to having a simple filter, water filter with a candle in it. But if that candle is coated in silver, then it kills all the bacteria, virus, and protozoa. And then there's biosand filters, where the water runs through various gradations of sand, which clean the water up quite well as well. So then in sanitation, the best thing is to build a toilet, but not just an individual or a family to build a toilet, but to get the whole community to build a toilet, because it helps a family's health, yes.
So toilets should be accessible for all community at any time, yeah?
Yes, all community anytime. You can't say when you're going to need it, so yes.
Yeah.
The communicable disease, the rate of communicable disease goes down, but it doesn't really drop until everybody has a toilet. So that's the basic thing about sanitation. Hygiene is, it's keeping clean, it's hand washing, it's face washing, it's body washing, it's
Cloth washing.
clothes washing, yes. And then where you do all that washing, keeping the drainage moving and away so there's not standing water. All those kind of things, and that affects life in many ways.
Since USAID is working in WASH sector, probably you are directly involved to look after that program. And how WASH is linked to overall development?
We just got started in WASH about 3 years ago. And we started with 2 small projects in Sirkat and Acham, and they went so well that we then planned our integrated nutrition program, which is in 20 different districts for 5 years, multi-million-dollar project. It also has a WASH component.
Is it Suhara project?
Yes, that's a Suhara project, yeah. And then the Kisan project, which is just getting started, is our food security project, and it is taking a lesson from Suhara and bringing in some nutrition and WASH in those 20 districts. So that's the context of where we're working at the present time, and then we're planning some more. So how does WASH affect development? Just completely. I'm going to give you the example of child mortality reduction. And you probably know that Nepal is just world-renowned and has received prizes for its child mortality reduction. It's one of the couple of countries that's on track and very well on track to reach the Millennium Development Goals in 2015 in terms of child mortality reduction. So how that happened? Well, first I'll say a few of the big and important ways. By women's education. There was when women are educated about health, they take care of their children better. Total fertility rate went down, so women have better health and time to take care of the children that they have. The logistics system in the country has improved, so the drugs are out there. But hygiene, sanitation, and water supply are also important.
When we are talking about the importance of WASH, we shouldn't forget the status or state of WASH in Nepal. For example, still 38% people have no access of toilet. Similarly, thousands of people have no safe drinking water, and lots of people have no idea of what hand washing. These are the major factors which are adversely affecting the human development of Nepal.
Yeah.
And how do you observe, how do you read, and how do you share the status of overall WASH situation in Nepal?
89% of the people have improved water supply. But I really admire the Department of Water Supply and Sewerage because they didn't leave it at that. They knew that a lot of those systems are not functional. So they did a big national survey and they found that I think it's 40-something%, the low 40s, of those systems are either not functional or need major or fairly major repairs. So water supply has a long way to go too in improving functionality. But in sanitation, we're really behind here in Nepal. The global rate of open defecation, meaning defecating out in the open, has dropped to 14% in the year 2011. So the average rate across the world, developing and developed countries, is down at 14%. But at that same time in 2011 in Nepal, the rate of open defecation was 36%. Now, with all the good work that's being done in the sanitation movement, I'm sure that's gone down already. But at that time, like you said, still there was 42% don't have improved latrines. So that's what we're working on, is to improve all of those.
Different development agencies and in the leadership of Government of Nepal, different WASH activities has been adopted and implemented. And the Government of Nepal has set the target of open defecations by 2017. Yes. And Government of Nepal has drafted different policies to meet that target as well. Which kinds of challenges do you see to achieve that target, national target?
Government has some wonderful strategies. In 2011, they launched the National Hygiene and Sanitation Master Plan. And in that master plan, there's the community-led total sanitation strategy. And government is encouraging every single district to set up their plan, their strategy for how they're going to achieve sanitation. There's a lot of commonalities in those plans, but there's also some differences. Each district is allowed and encouraged to think what's best for their district. Some districts use the strategy of having a reward, and that reward might start with the first ward that's open defecation free. Others might start with the first VDC. Others have penalties
Yeah.
for those who don't, and I think we saw that in the paper the other day. Yeah, for those who don't join with the community. But overall, what government has said in its analysis is that if we don't accelerate the sanitation movement, then we won't hit 2017. We're doing well, but not well enough. It would not reach total open defecation free status until 2021-22.
On the one hand, we have a target to achieve the missions. On the other hand, we have a lot of challenges, cultural challenges, or other different habitual challenges, and even geographical challenges. Lots of challenges are there. What may be the best strategy for overcoming that challenges?
Well, one of the challenges is Chaupadi.
Chaupadi.
Right?
Yeah.
Yeah. Now, Chaupadi, as you know, is that belief system that a woman is impure at the time of her menstruation and after giving birth. And government actually outlawed this practice some years ago, but you know, customs are deeply embedded and they have a lot of different aspects and all, so it hasn't just disappeared, this idea that women are impure and girls are impure at those times. And I think, though, that there's a lot of signs of improvement.
That is the special case of particular regions. But I'm asking in national level, do you see other challenges in national level to achieve that target?
For one thing, even by 2017, there's 4 years, and it's very hard to keep focus on a topic and to keep the momentum going, much less improve the momentum. So that's one thing, is how to keep people's attention, and things like your program right now. You know, this I hope is really taking this topic out there and letting people know that everybody is cheering for the sanitation movement and that we have to keep going. Some of the other challenges are that some different development partners approach the sanitation movement slightly differently. And government is really trying to get the development actors to harmonize and to agree on approaches so that when one family in VDC X is building their own toilet with their own money, they know that in VDC Y, their cousin's family is having to do the same thing. They're having to go, they're going out, digging their hole, building their pit and their superstructure and all. That's really important, that everybody be in agreement.
गत 14 वर्षको नेपाली पत्रकारितामा एउटा ट्रेन्ड सेटर बनेकोमा गर्व गर्छ हिमाल। यद्यपि देश, काल र परिस्थितिको यथार्थ चित्रण तथा सही विश्लेषणमा हामीले अझ धेरै सिक्नु छ र अझ धेरै काम गर्नु छ। नयाँ नेपालको नयाँ हिमाल,
नयाँ खबर, हिमाल खबर पत्रिका, हरेक आइतबार।
USAID is one of the major development partners of Nepal, which has been invested huge amount of resources to harness the national development. How USAID prioritizes the waste sector?
We went from 2 little projects to those projects plus 2 huge projects, and we're planning more. And I'd say that it's been a very steep curve. And I think it's been quite appreciated because it is such a multi-sectoral issue. Agriculture is happy to have WASH in its program, nutrition. We have a new environment section and team that's planning their program, so they're talking watershed and they're talking to us about water supply and water quality. I think we're seeing that water and sanitation and hygiene are truly cross-sectoral, as the government is seeing too. Ministry of Health, Education, Local Development, they all have roles to play.
As we already discussed, some changes have been seen in Nepali community regarding wash sector. Could you please tell us any 2 examples that impressed you, which is very impressingly changed and supported the development process, it is because of the quality wash.
I would absolutely have to talk about Acham ODF. Acham achieved ODF in April, but I think celebrated in May of this year. And it was only last year in December that the leaders, the government leaders and the local leadership and development agencies in Acham got together and said, wait a minute, we were one of the forerunners in the WASH movement, the sanitation movement, in the mid-90s, way before we started working there. Some of those organizations in Acham were already showing leadership with a number of different sanitation programs. They were so successful that a lot of their experience went into the design of the master plan for hygiene and sanitation. And they continued doing good work, but yet in December, they were not quite halfway there. 6 other districts had already become ODF, or open defecation free, and they wanted to be the 7th. So they looked around at each other and said, well, what do we have to do? We have to declare this a full-out campaign, a full-out, everybody give this your top priority and focus. And they gave themselves 4 months. 4 months. There were still, I think, 44 or something VDCs that weren't ODF. But they did it.
It is the case of Assam district.
Yes.
And another example?
In Rupandehi, our Suahara program is working. And it's the WASH section of the program has been going for a little over a year. And we went down to monitor and see how that was doing. And I was so impressed. They have a super dedicated, super involved and enthusiastic district water supply and sewerage officers, the district engineer, the senior divisional officer and all. And they are so well coordinated. They have every household digitalized. So as people build their new toilets, they've got it logged out in their computer. They know which VDC is moving faster, they know which VDC needs more help.